All right, guys, it is still early in 2022. However, there's already been a shift in the matrix, okay? As the mainstream liberal media is now questioning the CDC and saying, what the hell is going on? Okay, what is going on? Can we trust you, right? You're confusing people with your ever-changing guidance, right? Guidance that seems to change by the day, okay? And it's to the point now where a lot of these people in the mainstream media and the CDC are coming out and saying things that people were saying kind of a long time ago, right? Questions that people had a long time ago. Now, it started when CDC Director Rochelle Walensky could not answer the question from Bret Baier in regards to how many of the COVID deaths are from COVID, right? They just died from COVID versus how many people died with COVID. Take a look.
Speaking of statistics, it seems to make a big difference if a person in the hospital is in the hospital for COVID-19 or with COVID-19. It's been almost a year since you've been running the agency. Do we have that split on numbers?
What I will say is it differs by each variant. So some variants, first of all, we're doing screening of many, in many hospitals of everybody who's walking in the door. What we're seeing with the Omicron variant is that it tends to be milder person by person, but given how large the numbers are, that we're seeing more and more cases come into the hospital. In some hospitals that we've talked to, up to 40% of the patients who are coming in with COVID are coming in not because they're sick with COVID, but because they're coming in with something else and have had COVID or the Omicron variant detected.
Right. But I guess, do you know how many of the 836,000 deaths in the U.S. linked to COVID are from COVID, or how many are with COVID, but they had other comorbidities? Do you have that breakdown?
Yes, of course. With Omicron, we're following that very carefully. Our death registry, of course, takes a few weeks to collect. And of course, Omicron has just been with us for a few weeks, but those data will be forthcoming.
Guys, isn't it amazing that the director of the CDC doesn't know this information off the top of her head? Okay, we have this overall number of deaths, right? I think it's like 800,000 or so. Okay, COVID deaths. That's the way they frame it. They don't say deaths from COVID. They just say COVID deaths. Okay. And that number has been used to basically smear Trump, right? Smear Trump as being terrible when it comes to the virus. We're going to get more into that later, right? But I'm just trying to set you guys up for the main point of this video later. But you would think that if those deaths were deaths from COVID, she would say, yeah, the number's about 800-some thousand, so people died from COVID. But apparently that's not it, because she has to go get data, right, and information in regards to how many of those 800-some thousand deaths are actually from COVID, which means all those deaths that they're counting as COVID deaths may not be people who died from COVID, right? And that's a huge, huge, huge deal. It really is, because it means that we're not having a very accurate conversation in regards to what's going on with this virus. Okay, so that, along with the confusion that was caused by the CDC when, for whatever reason, they lowered the days required to isolate, right, when you have the virus, or you believe that you have the virus, even though Omicron is allegedly supposed to be more contagious. And then after you isolate, they're not even requiring you to test to make sure that you don't have it anymore. So those changes, which are very confusing, along with her not knowing this information, has even led people like Brian Stelter to roast up the CDC. Take a look.
Being very much in touch with the public, recognizing the CDC has turned into a punchline. It is so sad, but it's true. The CDC has turned into a punchline. Watch.
All of this mixed messages or new messages has led to a meme on social media poking fun at the CDC's advice, people letting off steam, of course. But is there a larger credibility problem with your agency right now?
And the answer is yes. There's a huge credibility crisis for the CDC. And Oliver, to your point, it just causes people, if they hear all these mixed messages and all this confusion and it's all too complicated, they just move on and ignore it.
Yeah, so leave it to Brian Stelter, right, to state the obvious about how people actually are feeling about the CDC in regards to all the confusion coming from this government institution, right? Doesn't seem to have all that much credibility at this point, okay? But he's not the only CNN news anchor that is going in on the CDC. You have Jake Tapper, who's also going in on the CDC, regarding the statement from Rochelle Walensky about how 40% of patients admitted to the hospital with COVID actually came there for something else. They aren't in the hospital because of COVID. Why is Jake Tapper's reaction to that? Take a look.
So the hospitals are still stretched thin because of this, so I'm not trying to take away from that. But if 40% in some hospitals, 40% of the people who have COVID don't necessarily have problematic COVID. They're there because they got in a car accident. They're there because,
right.
They bumped their head, and they're being included as in the hospital with COVID. That number seems kind of misleading.
Yeah, I agree, Jake. It surprises me that they have not been able to parse out that data more carefully. I think the data that Dr. Walensky is quoting is from New York State, and we've been following that data as well. And I can show you what we've seen, sort of tracks with what she said. But out of all the patients that are in the hospital, about 57%, these are COVID patients, admitted because of or complications from COVID, 43% admitted for other reasons and then diagnosed with COVID. I think, there needs to be transparency about that in terms of for or with COVID. The only thing I will tell you, Jake, again, working in the hospital, is that at the time someone is then diagnosed with COVID, even if they didn't come in for that reason, it does take up a lot of resources then in terms of infection protocols, personal protective equipment, more testing, all that kind of stuff. So even though that may not have been the initial impetus to bring him in the hospital, it just requires a lot of energy and resources on behalf of the hospital staff and the testing and all that sort of stuff. So we need to get better about being able to see this data. New York State, I think, is one of the few states that's presenting it that way, for or with COVID, but other states should follow suit. The American Health Association says they have a hard time sort of separating out that data, but clearly New York State's been able to do it. Other states should do it as well.
Yeah, we're 2 years into this, and we need the clearest picture possible. If somebody's in the hospital with a broken leg and they also have asymptomatic COVID, that should not be counted as hospitalized with COVID, clearly.
So again, CNN catching up with reality, right? Catching up with what a whole lot of people have had questions about, right? So the two numbers, guys, that they've been using, okay, COVID deaths and COVID hospitalizations, those numbers, again, according to the CDC director, okay, she's the one saying it, not me. She said, listen, those numbers, we need a little bit more nuance on those things, right? Because they don't really tell the whole picture, okay, about whether or not these people are being hospitalized or dying because of COVID, or whether or not, they're being hospitalized or dying with COVID, which are two very different things. And combining those two numbers together can make the story seem different than if you separate out those numbers independently. Okay, do you guys see what's going on here? Right? And I have a theory in regards to why this is happening all of a sudden at this junction in Biden's presidency. But before we get in that, Rochelle Walensky did give us some insight. She followed up after the criticism of her. She gave us some insight on these numbers in regards to the COVID deaths and what the breakdown might actually be.
Headlines that we're talking about this morning, this new study showing just how well vaccines are working to prevent severe illness. Given that, is it time to start rethinking how we're living with this virus, that it's potentially here to stay?
Really important study, if I may just summarize it, a study of 1.2 million people who were vaccinated between December and October, and demonstrated that severe disease occurred in about 0.015% of the people who were received their primary series, and death in 0.003% of those people. The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with. And yes, really encouraging news in the context of Omicron. This means not only just to get your primary series, but to get your booster series. And yes, we're really encouraged by these results.
All right, guys. So she's saying that over 75% of deaths from those who have been vaccinated are people that had 4 other comorbidities, right? That's what she's saying. Okay, which to me kind of seems like an indication that, hey, you know, these people who are dying, a lot of them have some other issues as well. They've been sick with a lot of other stuff too. Okay, which in my opinion kind of, you know, makes you think about, okay, well, how many of the 800,000 people that have died, right, COVID deaths, how many of them are actually from COVID? How many of them are not from COVID, but from something else? They just happen to have COVID at the time. I think this is important information that American people wants to know. And the CDC seems to be slowly trickling out data, trying to tell a little bit different story about what's going on with this virus. Now, guys, you know, this comes just as Biden, just a week ago, was saying that, hey, there is no federal solution to COVID, right? And you've seen the CDC director make statements about vaccines that I can't repeat on YouTube, or else, you know, I'll get kicked off, I'll get a strike, right? I can't repeat those statements. They're saying stuff like that. That information is coming out, and it seems to be right before the midterms, right? The midterms in which, you know, Biden ran on this idea that he was going to stop the virus, that the reason why the virus was spreading so much and the reason why we were in the situation we was in was purely because of Trump, okay? And that Biden was going to come and defeat this virus. Now, obviously, that has not happened, okay? Even with the vaccines, okay? It hasn't happened. We're still dealing with it, right? Some argue that we could be in a worse situation, right? So Biden can't run on that anymore, which brings me to like the whole point of this video. Don't be surprised if the narrative starts to change surrounding this virus. Do not be surprised. And the reason why is because the Democrats are not going to be able to win, considering that there's a lot of fatigue coming from these lockdowns, these restrictions, what's going on with the numbers, okay, with the virus spread and all that stuff. They're not going to be able to win on this anymore, okay? So now the narrative has to change. They have to say, okay, what are we doing good, right? Or at the very least, make the numbers look a little bit better, right? In their favor, use some nuance. This is why now all of a sudden you're getting these conversations about, oh, well, what does that COVID death number actually mean, right? Because remember, under Trump, that COVID death number meant whatever the highest number was, whatever they can get away with, right? Because every death from COVID was Trump's fault, right? Every death from COVID was Trump's fault. So with that same logic, every death from COVID should be Biden's fault, right? That's what the mainstream media said. So with that being said, the best way to cut down on that number, right, is to start actually talking about, okay, well, this is how many deaths are actually from COVID itself, right? These are the deaths actually caused from COVID. You see that number? That's a whole lot smaller than 800,000. That number you've been seeing, right? That number we've been put up there from Trump. Biden's numbers are a whole lot smaller. You remember the hospitalizations? Well, look at this new number, right? Hospitalizations from COVID. You see that number? That number right there? That's the actual real number. You see how it dropped, okay, from hospitalizations associated with COVID to now hospitalizations from COVID? That number right there, that's the number that you guys should actually be paying attention to, right? Those are the numbers that matter now. All of a sudden, hospitalizations don't look that bad anymore, right? Biden may have done something, right? I think that's what's happening here. Okay, I really do. I think that these numbers are starting to come out and that the narrative is going to change because, simply put, the Democrats have not done a good job when it comes to this virus. All they've done is implement these lockdowns, these restrictions, these mandates that really haven't changed anything. Okay, so the question is, why keep doing something that obviously doesn't seem to really be working all that well? Why keep doing it and taking heat for it, considering that it's not working well? Why keep doing that when you can just change the narrative, right? You can have the CDC come out here and say, hey, listen, y'all ain't got to isolate that long. You ain't even got to test after you finish isolating, right? That is a weird change up from the CDC that's been, you know, flip-flopping a whole lot. That's a weird one because they're basically saying, hey, look, Even though this Omicron thing is surging, this thing we've been scaring y'all about for the past month, hey, we're going to loosen up the standards, right? We're going to ease back a little bit. When they've done that? When they done that? I think what's happening here is that Biden realizes we can't stop this. There's nothing we can do about this. The vaccine mandate in the Supreme Court is probably going to get shot down. Let's just change the narrative, right? Let's probably loosen up and start talking about the deaths differently, right? Let's talk about how many people actually died from COVID, right? Let's not be so strict on our guidelines anymore. Maybe we don't want to keep pushing this stuff, okay? Biden said there's no federal solution to the pandemic. He already said that. He told us that. But I really do believe that there's something to this, okay? Because even the mainstream liberal media is getting openly fatigued, right? Where they're like, listen, come on. We got to go back to normal, right? We got to stop all this nonsense, okay? Even the liberal mainstream media is getting there, okay? That's why they're now going after the CDC and questioning them, something they should have been doing from the get-go. Because, again, the narrative is probably going to change, right? I believe so, to try to save the Democrats come to midterms. But again, that's my wild theory. Let me know what you guys think. Make sure you like, comment, and subscribe. Most importantly, share a Black conservative perspective. Peace.